OET speaking, sample test 5, ocular migraine, optometry. Your 42-year-old patient who has hyperopia, farsightedness, and uses prescription glasses has recently experienced a headache and vision problems for the first time. You have just examined the patient's eyes and checked his or her prescription. You suspect an ocular migraine. Find out more about patient's symptoms: onset, difficulty focusing, flashing lights, one or both eyes, headache, etc. Find out more details: any floaters, blobs, sensitivity to light, etc. Explore any other symptoms, for example, nausea, vomiting, etc. Give findings of eye examination, for example, glasses prescription correct, unlikely to cause problem, etc. Give likely diagnosis of ocular migraine, restriction of blood flow to eye, sudden narrowing of blood vessels, etc. Explain need for further tests, for example, dilated retinal examination, visual field examination, etc. Reassure patient about ocular migraines, for example, temporary, long-term damage, rare, etc. Outline common triggers: smoking, hypertension, stress, dehydration, low blood sugar, etc. Explore relevance of these to patient. Emphasize no specific treatment for ocular migraines available. For example, usually self-resolving, etc. Describe likely cause for this patient. For example, stress at work, dehydration, etc. Make recommendations for management of symptoms. For example, avoiding triggers, painkillers for headache, resting eyes, etc. Outline next steps. For example, tests, doctor appointment, excluding other conditions, etc. Patient roll card. You are 42 years old and are far-sighted. You use prescription glasses. You recently experienced a severe headache that caused vision problems for 20 minutes. It was the first time you have experienced anything like this. The optometrist has just examined your eyes and checked your prescription. When asked, say you had the headache and vision problems a couple of days ago. You had some trouble focusing and then saw flashing lights on the right-hand side of your vision, in the right eye, for about 20 minutes. Your vision went back to normal, but you had a severe headache. When asked, say you didn't see any floaters or anything else. Your eyes were just sensitive to the light. When asked, say you didn't feel sick or vomit, but you're concerned because you've never had anything like this before. You wonder if it's just because your glasses prescription was wrong. Say an ocular migraine sounds serious. You hope it doesn't mean that there will be permanent damage to your eyes. When asked, say you don't smoke or have high blood pressure. You sometimes feel stressed at work. You're an aircraft maintenance engineer. You know you don't drink enough water. You sometimes skip meals when you're busy. You hope you can get something to take in case you get a migraine like this again. Say you'll follow that advice. You just hope you don't get another migraine. Okay, Peter, I've just finished the examination now. Are you feeling okay? Yes, I'm feeling okay. Thank you, Michael. I would like to ask you some questions about your symptoms, if that's okay. Yes, that's fine. Could you please tell me when the headache started? The headache and the vision problems started a couple of days ago? I see, a couple of days ago. And have you had any difficulty focusing? Yes, I have had some trouble focusing. I see. And what about flashing lights? Did you see any flashing lights? I did see some flashing lights on the right-hand side of my vision, in the right eye, for about 20 minutes. Yes. I see. That must have been a little bit scary, was it? Yes, it was quite scary, actually. I hope it doesn't happen again. Try not to worry. I'm here to help you. And hopefully we can resolve the situation today. Let me ask you a few more questions. Did you see any floaters? No, I didn't see any floaters. That's good. No floaters. And were your eyes sensitive to the light? Yes, my eyes were definitely sensitive to light. Okay, that's important to know. Thanks for that information. What about nausea? Did you feel nauseous? No, I didn't feel nauseous. Did you vomit? No, but I'm very concerned because I've never had anything like this before. I understand it's concerning, Peter, but try to stay positive and we will get to the bottom of this problem for you. I'd like to give you my diagnosis now, if that's okay. Yes, that's fine, thanks. I think you have what we call an ocular migraine. This basically means there is a restriction of blood flow to the eye, which could be caused by the sudden narrowing of blood vessels. Are you following me? Yes, I'm following you. It sounds serious. I hope it doesn't mean that there will be permanent damage to my eyes. Try to stay positive, Peter. I can assure you long-term damage is very, very rare. But we do need to do some further tests, like a visual field examination, to make sure everything is okay. There are some common triggers, which include smoking, high blood pressure, stress, dehydration, and also low blood sugar. Do you smoke? No, I don't smoke. I can't stand smoking. That is good. Do you have high blood pressure? No, I don't have high blood pressure. What about stress, Peter? Do you feel stressed? I sometimes feel stressed at work. It's true. I'm an aircraft maintenance engineer and my job can get quite hectic. I see. Your job can get quite hectic. I understand. What about water? Do you drink enough water? No, I definitely don't drink enough water. Sometimes I skip meals when I'm busy too. I hope you can give me something to take in case I get a migraine like this again. I understand you'd like something to help, Peter, but I'm afraid there's no specific treatment for ocular migraines, and they usually resolve themselves. A likely cause is stress at work and dehydration. Are we on the same page? I see. So you think it might be stress and dehydration. Okay, I hope you're right. Do you mind if I make some recommendations on how you can manage the symptoms? Please do. So, Peter, you should avoid triggers that may start the migraines. Take painkillers as needed and rest your eyes often. How do you feel about that? Okay, I'll do my best to follow that advice. I just hope I don't get another migraine. Hopefully, if you follow this advice, Peter, you'll be right as rain going forward. Is that okay with you? Yes, that's fine. Thank you very much for your time today. Thank you, Peter. Good luck with everything. Stay positive. You'll be fine in no time. Bye-bye. Pause the video and practice. Please like the video to help me build this channel for you. Thank you for watching. Good luck with your studies. Stay motivated. You can do it.